Good morning, professors and dear colleagues. I'm CC resident Stephen Wang. Today, I'd like to present the journal with the topic of long-term 3D condylar remodeling in the mandibular retrognathia with the high mandibular plane angle patient. And this paper was published last year in a clinical oral investigations with the impact factor of 4.29. And for the introduction, the high mandibular plane facial morphology was the most dominant facial profile which experienced TMJ abnormalities with the resultant condylar resorption. The condylar resorption usually accompanied by the TMJ pain. However, there was still 30% of patients remain asymptomatic. And the condylar volume deficiency will cause the posterior rotational growth of the maxillomandibular complex, and also the high mandibular plane facial profile, which will need aesthetic and functional correction. And the condylar volume deficiency will cause the slight mandibular retrusion in the early stage, and also decreased ramus height and neuroman bite, and even oropharyngeal airway and airway obstruction in the later stage. For the treatment of progressive condylar reabsorption, the OGS will be considered. It can restore the patient's aesthetic functions by alteration in a spatial position of facial bone segment. And however, there was still a paramount concerns like the long-term condylar reabsorption condition will remain unknown, and the surgical stability was also considered. And the treatment requirement before starting, of course, we will have to do the accurate evaluation of each cases and a discussion of the expected consequences. So in this study, the investigation of long-term condylar remodeling, the timing will be, there will be two timing. The first timing is presurgical orthodontics treatment, and the second timing is after OGS. And we will use the CT and the three-dimensional tools to do the assessment. So for the purpose of the study, this is first study to quantify the 3D condylar remodeling of the mandibular retrognathia with the high mandibular plane angle, and which evaluation in the two time interval. And this study is aimed to define the correlation between the status of the condylar remodeling. And the hypothesis will be the condylar reabsorption following OGS could be the part of progressive presurgical resorption process. Material and method. This is a retrospective study, which the patient enrolled will be the adult with the mandibular retrusion, high mandibular plane angle, which was defined as a salination to mandibular plane angle over 35 degrees. And the patient will be included if the patient has a history of TMJ trauma and craniofacial syndrome, TMJ pathology, or any of the previous TMJ surgery. And we use the DICOM and the CT scan analysis in the tool was listed below, and the right side lower part will show this the ITK snap we can use to see the centric occlusion. For the interval of examination, there were two intervals we have mentioned before. And the T0 is called the first diagnostic visit before any treatment. And the T1 will be after complete of the presurgical treatment of before surgery. And this, so T1 will be after orthodontic treatment. And the T2 will be long-term post-surgical follow-up, which defined as post-operative, post-OGS surgery. So T0 to T1 will be pre-surgical phase. T1 to T2 will be post-surgical phase. And this is the tool. As you can see, the left picture. As you can see, the T0 will be the green picture, green color on the 3D simulation, and so pre-orthodontic and post-orthodontic treatment, they will be slightly different. You can see in the simulation in 3D part. And this study also evaluation the different aspects. You can like superior part, lateral segment, lateral part, and the posterior part, anterior part, and different part reabsorption also measurement in the millimeter level. So for demographic data, there will be 25 patients with the 50 condyles in this study, and the age is average age is around 23-year-old. And the mean time of interval, the presurgical phase, the T0 to T1 is about 1.5 years. And after OGS, the follow-up mean time interval is about 1 year and 3 months. And the OP procedure, every patient was performed level 1 osteotomy, BSSO, and a genioplasty. Okay. So the result, the condyle remodeling was observed during the both phases, the pre-surgical phase and the post-surgical phase. And overall condyle volume changes, the post-surgical condyle volume changes is significant significantly many than the pre-surgical phase. A P level is less than 0.001. And the T2 phase, you will see after the OGS surgery, the condyle volume reduction was noted, increased significantly more than the T1 level. And the volume reduction over 30 millimeter over 30 in the pre-surgical phase is only 80% patient, because so the patient performed orthodontic treatment, then there was only less the volume reduction in this phase. However, the post-surgical phase, there were about 84% of patients have experienced over 30 volume reduction, and the anterior surface remained relatively stable in this article's evaluation, and 34% of reabsorption rate. And the condyle volume changes. This is they use the 3D simulation to show as you can see, the color in the red means there was a millimeter decrease. The volume is decreased. So in this simulation, as you can see, there was also in the posterior, lateral, anterior, and even the medial side, there was all have the condyle reabsorption the condition. And you also have the volume changes after also the negative value in the medial side. As you can see, the red part is also in the superior is more significant, and there is also a little bit at the lateral part. So the condyle remodeling, we have found that the author have found the older age will show the higher bone reabsorption at a superior surface. As you can see, the previous 3D simulation, there was more a red color in the superior part. And if we have a higher SMJO every angle, there will be higher reabsorption at the lateral surface in the presurgical phase, and also increase overall condyle volume reduction in the presurgical phase. However, the higher this angle, there will be in the postsurgical phase, there will decrease overall condyle volume reduction. There is very interesting result. And the condyle remodeling, there will be longer postsurgical follow-up period. And if there is a longer postsurgical follow-up period, there will be higher bone absorption on the medial side of the condyle. This makes sense. And the counterclockwise rotation will decrease the bone absorption at the superior condyle surface. So for the presurgical mandibular plane angle, it's the only independent variable that will cause the remodeling on the lateral surface and overall condyle volume change during the presurgical phase. For each degree of mandibular plane angle change, there will be 0.016 millimeter increase in the lateral surface resorption and 2.38 in the condyle volume reduction. For this mandibular angle changes, they also have the effect on the remodeling the medial surface and the overall condyle volume changes in the postsurgical phase. For each degree in the postsurgical phase, will increase the 0.08 millimeter in the lateral surface resorption, and also the 11% of the condyle volume reduction. So for the discussion, this paper was have time interval, 2 period to evaluation the condylar absorption. Is presurgical orthodontic treatment and after OGS. The condylar remodeling was was obvious, and there was a stable condyle volume during the presurgical phase, relatively compared with the post-surgical stages, and there is low rate of bony changes. And there was higher condyle volume reduction after OGS. So previous study have also reported that the sign of condyle remodeling, particular bone reabsorption in the OGS can be noted at 6 months postoperatively and may come out of 2 years. A previous study of the condyle volume reduction, Gomez et al. have shown that 58% of condyle experience volume reduction following the TMJ disc repositioning and after simultaneously counterclockwise rotation of the maxillomandibular complex. And Site et al. Is also over 60% of condyle volume maybe susceptible decrease in the post-surgical relapse. And in a current study, we have found the author have found that 80 condyles have over 50% of reduction of the condyle volume during the post-surgical phase. And when we see the localized condyle surface remodeling, the pre-surgical phases in the after orthodontic treatment, the all surface were relatively stable. And the previous study also have to show the onset of idiopathic condyle resorption, well, mainly at the tubercle growth in the age of between 11 to 15-year-old, and the average of the 1.5 millimeter resorption rate per year. And the exposure have shown the mean age. There was a condyle height that 0.8 millimeter decrease in the average in the mean age of the 50-year-old, and 70% of the condyle experience no changes in the radiological experience during a 2-year follow-up period in orthodontic treatment. And the favorable remodeling was associated with there was two explanation by the author. The first one is presurgical orthodontic treatment itself, and another one is with the endochondral growth. It will promote the new bone formation as an adaptive for favorable biomechanical process. And there was a 2 to 24% of condyle surface, including this study, have experienced over 1.5 millimeter bone resorption. And another study have shown there also have this similar result. There were 10 to 50% of the condyle surface have resorption over 1.5 millimeters. And the class 2 and high mandibular plane angle will have a poor TMD improvement after OGS. And the condyle remodeling, I have shown the previous study have showed the improvement of condyle remodeling. If the patient performed the TMJ disc repositioning and the counterclockwise maxillomandibular rotation is more improving than just perform the OGS. And the overall condyle volume changes compared with in the pre-surgical and the post-surgical phases also is all a negative correlations. So reabsorption was noted, and predisposed factors have higher incidence of condyle remodeling. The OH will be the predisposed factors. So the older of the age, the higher of bone absorption on the superior surface post-surgically was noted. And higher preoperative mandibular angle will increase the bone surface resorption and lateral surface, and overall condyle volume reduction, and overall and in the pre-surgical phase. However, they will decrease the overall condyle volume reduction in the post-surgical phase. The mandibular, the mandibular angle plane we have used to do the correction of the mandibular. We will decrease the bony resorption in the superior condyle surface. And the previous study have shown if we do the higher surgical counterclockwise rotation, it will decrease the bone resorption in the posterior and lateral surface and lower overall the volume reduction. And several previous studies have shown the larger surgical mandibular advancement has a higher reabsorption rate. So the conclusion, there will be no correlation between the counter reabsorption and the of presurgical and post-surgical phase, which could reject our previous initial hypothesis that counter reabsorption follow on OGS might be part of progressive presurgical resorption process. There's significant counter resorption following following OGS correction of the retrognathia mandible with high mandibular angle may be expected in the presurgical remodeling stages of the condyles. So this is my presentation. Thanks for everyone. 我就觉得他写的有点复杂。
这大家我们这个可以猜，第一个是 mandibular angle 的原因，就是因为康德本身小，对小的原因是因为小学，但是小的原因是可是有 passive。那开刀后，显然它的要证明是说开刀后并比开刀前更有意义的变化啊。对，那开刀就是一个 factor， 要比没有开刀应该造成这个小血的风险。是，结论是这样的。对，这个大概是他们也算是大家都知道的可能的啦。那也就是说，在开刀前一定要跟病人稍微提醒一下，就是说所谓的受刑就 relax 的感觉。是，那到底 severe 到什么程度？到时候就来控制。我想王炯勋主任他有相当的经验跟兴趣在 study 都是可以的。这个呢，他现在考虑到什么样？他用他的方法讲到蛮多怎么样能够prevent。那第一个当然开刀前的一些 exercise sleep 啦哈。那第二个是设计。那设计的时候呢的那个，他现在讲的 condylar rotation 的时候是对，但是 condylar rotation 他讲到 advancement 多的话，会影响去更多，对不对？对，是这样。对，所以 condylar rotation 事实上它是一个把 laser 往上推，这个都不要 advance， 它就跟着上去。对，这是 condylar。另外一个是 advance 以后，你上面不动，然后上面的动的地方也是 condylar 弄短一点点，但是不要 advance。像廖师做的是 advance 做的，那王医师做的是那很多，然后这样子再了解一下。这 pure 都没有 advance， 只有 condylar rotation。事实上它是没有增加的 tension 放减少。对，可以说 muscle 都是变短。对，那如果是 advancement 本身，你 muscle 就被 stretch， 所以 condylar 的那个上的那个 ratio 一定增加。啊，所以这个可以了解。所以但是呢，大部分我们做的都是 advance 加啊，对这个才会达到那种效果啊。那所以这个又把它弄在一起。我们有很多的 data 那我们可以用我们 data 的方式去 run 一下我们的 data 的那个对它是的 condylar 是相当恢复，不过这个要矫正两个来帮忙一下，因为这些 reaction 跟那个我们外科医师不是那么熟，或者可以研究出他们研究的很多研究生，市场这是蛮好的，相信以后可以弄一个小专题，专门来study condylar。他睡的似乎都没有被人家太重视，他睡似乎condylar的问题跟condylar的那个小因素。
对，他这边也是讨论 class 2比较多。
有没有要发言？对于这个 Class 2开那个 OGS 之后 condyle 的 resorption 的部分，或是辉哥主任有没有要发言？有，辉哥请说。
林彦宏有没有今天有没有邀请他？林
没有，
彦宏
今天没有发给他，对。
因为这个康达的问题看起来很多 paper 讲的面向上面来讲结论都不太一样了。那这一篇我不知道他因为我比较晚进来，他有没有他 total 是多少个 number？
25个 patient， 50个 contact。
对，所以25个感觉还是不多了那当然他有 exclude 掉一些原本 condyle 就不好，但是 condyle 好不好，或者是有时候之前的 history 有时候也要参考进来，因为如果这样子挑选下来，有时候 selection criteria 是一个问题啊。那通常这种 study 的话，如果他有找一个专门在做 TM joint 的医生进来的话他是比较容易有一个比较明确的方向跟挑选的结果。那这个挑选的 case 越 clear cut 的时候，它的结果是越可信的。那如果它的 exclusion 的方面没有比较 mix 的时候有时候这个到最后到底是因为它的surgical planning 或者是 movement 的方向造成的问题，或者是它看到本身的问题，有时候会没有办法理清。
是因为这个文章在 COI 这一篇 journal 应该是蛮有公信力的，因为这个蛮难投的，在 orthodontics 上面。对啊。不过他的 case number 数是真的不多。对。好，谢谢辉。
有时候投得上是因为他的方法比较新，或者是看的方向比较不一样因为他有把它区分说 conda 的哪个面向啦一般来讲都是 superior 或者是 posterior 这个方向可能是大家比较有兴趣这样子。
OK， 好，谢谢辉哥。OK，
好，谢谢。
好。有一次可能在上面，对。OK， 会选这个，主要是因为我们蛮多 case 是在2级咬合开完之后，确实半年或1年之后，感觉它 resorption 完之后有点开始在 open bite 或 overjet 就跑出来了，会被 orthodontic 提醒的。那有时候 orthodontic 它有很多的想法，有些人会做 multiple piece， 像现在做口控来解决它那个 bimetal 或者说它整个 movement 的量移动前太多的问题，它就可以 advance 量比较少一点点。但是有些 also 又可以整个 one piece 去把这个做一个很好的 correction。那就像刚刚主委讲的，黄医师大概就是选择 one piece 的，下面也不会给你拆多片的，那他就会做 over correction， 然后再慢慢回来。那有些人 also 是不太一样，这个真的要跟 also 好好讨论说不同门派来解决 class 2的之后，开完刀都很好看，可是1年后2年后那个 story 就完全不同。对啊，尤其在 long follow up 的时候。对啊。是这样子。
这蛮有意思的，说确实整个设计的方式不太一样，我理解到底是真的差多少？那真的要用报告，黄教授也是强调了用报告，而且他们分析的数量2年还不多，对，找到问题，我们就好好的做，可能的话就抓住每个 case， 会不会再回来是一个很难抓的，很难抓。问题会，因为我的问题就是我说到，因为我们练太过多的话，你现在抓出去能够抓5年2，会知道20 是希望是哪一个区？谢谢。好 ，OK， 杨某有了吗？有，我是第四题。好，好了，谢谢。
感谢老师。
大家光是2720在。
是，应该是要讲。